Welcome to the American Menopause Company. This is Dr. Brianna Guan, and I am Dr. Lisa Robinson. And today we're talking about testosterone. So we're going to dive right in. What are the symptoms of low testosterone?
In practice, I see women displaying feelings of lack of gusto. I like to say sparkle, lack of motivation, drive. They feel depressed often. Depression is one of the biggest symptoms I see with lack of testosterone. And I like to say sparkle, but
Low,
how about you? What do
okay.
you see, Doc?
Yes, low libido and that lack of socializing, wanting to socialize, just saying, hey, I'm just going to hang out in my bedroom, shut the door, everyone leave me alone. Yeah, we don't have time for that. So what role do you see DHEA playing in patients who have low testosterone?
DHEA is a hormone made by the adrenal glands, and we have a lot of it in early age and it goes down with life. Stress can deplete DHEA levels, so women who have higher stress can display low DHEA. DHEA gets converted into testosterone and also to estrogen. And so, if your DHEA has been diminished from adverse childhood events or chronically burning the candle at both ends, that low DHEA can lead to low testosterone. I also see it in women who are having fertility issues. Their estrogen levels will just be lower without that DHEA. And so for menopause, I because testosterone is a controlled substance in my personal practice, I don't prescribe with testosterone. I utilize DHEA to help grow estrogen levels for fertility. I also use it to help boost testosterone levels. And I also will recommend adrenal adaptogenic herbs to help restore adrenal hormone function. So I think DHEA is so important and often could be a first line therapy before jumping into testosterone for some women. But Doc, you have been prescribing testosterone and you do that in our company, the American Menopause Company. We both think that testosterone is amazing and we love testosterone, not too much, but just the right amount. Can you tell us how do you help decide is testosterone appropriate for someone?
So if the woman is having symptoms and then we check their levels and confirm truly they're low, so that would look like maybe 5 to 20 would be considered low. Then, as long as the patient doesn't usually have acne, for instance, or abnormal hair growth, then we can just go ahead and put them on testosterone. So, levels are important to talk about. Want them like maybe around 80, 100 maximum. We are not trying to get the patient at 2 or 300. Those are male levels. They might feel great temporarily, but then not so much. So, the forms of testosterone are several for women, and I mostly put patients on either creams or troches, whatever's convenient for them or that what they're comfortable with. The creams are sometimes not absorbed, so that might be a challenge. Troches are pretty easy. And so the dosing is variable. Dosing starts at around maybe 2 milligrams. And probably the most I've had a patient on is 15 milligrams. That would be a high dose for women, but some because of the conversion, some patients don't convert that to a usable form, so we have to just make adjustments. Also, the patient should be monitored on testosterone therapy because the hematocrit can increase with that. Blood work in the American Menopause Company to monitor patients who are on testosterone therapy.
And testosterone therapy for women always seems to be targeted at libido, right? Like that's
Mhm.
the reason why a woman would get testosterone, but doesn't it I mean it extends far beyond libido, right?
Yes, as an example, it's important for bone health and protecting patients from osteoporosis. It does affect the metabolism and ability to gain muscle and so fight, if you will, sarcopenia, which is an important part of aging that we want to combat so that we age well. So yes, testosterone does more than just contribute to the libido.
Right, because with menopause, women are losing muscle mass, and
Hmm.
so in order to prevent insulin resistance and
Hmm.
prediabetes, diabetes, Alzheimer's, and all of
Hmm.
cancer, having muscle mass is vital.
For sure. Yes, absolutely. patients are, usually concerned about um, kind of increasing fat cells and fat deposit in the middle. We don't like that happening. And so testosterone can help maintain, again, that key muscle to fat ratio to maintain the metabolism and glucose, processing of glucose, because as we age, it's super important not to be in a hyperinsulinemic state. So I think it also works to maintain glucose levels.
So important. Well,
Well,
thank
thank you.
yeah,
This has been great, and I look forward to our next topic.
me too. Thanks so much, Doc.
Thank you.